Hi, I'm Danica Koopmans.
And I'm Sharon Hughes-Geeky. We're your hosts of Docs of Vernon. This is an interview and podcast series designed to help you navigate the healthcare system and get to know the physicians that provide your care.
Topics include what the heck is a hospitalist, treating addictions, and alternatives to going to the ER, plus so many more.
This is your link to healthcare in your community.
Today, I have the privilege of interviewing Dr. Catherine MacKinlay. She is a fellow of the Royal College of Canada. She works in a group of pediatricians that provide coverage to the community as well as the hospital. She'll do admissions and see patients outside of the hospital as well. She also works in a clinic with other specialists, in pediatrics. And she is a mom of 3 to a 13-year-old, 11-year-old, and 9-year-old. She's married and loves being active with her family, going to the beach, I should say the lakes, and the ski hill, of course. And most of all, she just loves the time she gets reading on the couch with her kids and her family all together. So welcome, and thank you so much for being here.
Thanks for having me, Danica.
Today is exciting. I don't know about you, but I'm very excited to interview a pediatrician. I think many of us go through life who have children and wonder, so many questions. But we're not going to talk about everything today. First, I just want to hear from you, what does it look like in the day of a life of a pediatrician? We named a few things that you do, but if you could just elaborate.
Yeah. Okay. And I'll start off by saying, even as a pediatrician, I still have lots of questions every day in the life of parenting my own children. But my day looks a bit varied depending on what's happening at the hospital. So generally, my colleagues and I are covering for any newborn deliveries that are happening, any emergency room cases where the children are sick enough to need an opinion of a pediatrician or need admission to the hospital. So on lots of days, I'm covering that service, and then heading down to my clinic where I see outpatient appointments. So that would be kids that have been referred from their family physician or nurse practitioner for many different pediatric challenges. So anything from headaches and constipation to learning issues and ADHD. And we provide consults to the primary care provider to help figure out the best course of action for the kids. And some of them end up being followed in our practice for quite a few years, especially anybody with really complex medical scenarios. We will sometimes follow kids for years, and sometimes it's just a one-off where we can give some advice back to their primary provider. So it's a pretty varied day. We do have some teaching in there with some med students and some residents, both family practice residents and pediatric residents. And then at the end of the day, trying to get home in time to help shuttle my kids around to 8 million activities. So we're at the rink for my girls play ringette. We're at gymnastics. We're Dungeons and Dragons for my son. So all over the place, trying to keep up with them. And then again, some nights on call for the hospital. So some nights come home, but end up having to go back to help with a newborn that's in distress or helping out in the emergency room. And, just doing our best to provide that care for the kids in the community.
And it's a big undertaking because how many pediatricians are in Vernon right now?
We've got 5 that are in Vernon, and we're actively trying to recruit a few more. Like many communities, especially the more rural and remote communities, there's a need for people to come and join. And I think some people get a bit intimidated. I was sure intimidated coming to a smaller center, not knowing if I'd be able to figure out how to do it all. But actually, it's such an amazing way to be integrated in the community and be the touch point for so many different pediatric services.
Yeah, that is something really unique and special about the community. So if you have 5 now, how many would kind of optimize? Because I've seen you in action and I know how busy you are. So I cannot imagine that you're operating at full capacity at this stage.
Yeah, we'd love to have at least 7. As the community continues to grow, I think, there's always going to be room for adding more, but we do end up having to send quite a few kids out to BC Children's Hospital or or a higher center.
I think as much as Vernon can provide a lot, we know that it's the cold and flu season, and
Totally.
I wanted to hear from you what your experience has been just this year in general or in past years.
So we always prep that this is going to be the busy time of year, sort of the December to March chunk, where we know that that influenza, RSV, COVID, and then all the other just regular coughs and colds are going to be rampant. And, we have definitely seen that this year where we've had lots of really sick kids showing up. So, just to start with like your basic recommendations, all kids get sick regularly. The general rule is that preschool to early childhood kids are going to get sick like 13 times a year. And many of those are chunked between that December to March. So for lots of families, it just feels like their child is constantly unwell. And that's true. And over time, most kids will develop enough immunity to a lot of these viruses where it starts to get better. But those yearly ones that are still going to hit, the COVID and the influenza, different strains every year. So unfortunately, those are ones that you can kind of expect to get hit with most years. And so, if your child is unwell, fever can be a really tough thing for kids to struggle with. Some kids aren't really bothered at all, and you don't need to treat it if that's the case. But if your child is really uncomfortable, then Tylenol and Advil are very appropriate, and you can actually stagger them 3 hours Tylenol, then the next 3 hours Advil, and give them on a 3-hour rotating window, and just making sure that you're giving an appropriate dose. So basic home treatments are really just fever control, hydration, and then good hand washing and keeping them away from other sick people in the family if you can. When to come to the hospital would be if they've got labored breathing enough that, you can hear them either wheezing or they really seem short of breath. And any child who really isn't waking, is more lethargic than normal, those would be good reasons to bring them to the hospital. So many of the viruses this year have had prolonged fevers, kids really sick for that 3-4 days, but getting over it at that point. If your child is really on that 5th day of a high fever and they're getting new symptoms or they're not getting better, then that would be when we would want to make sure that there isn't an evolving pneumonia or that there isn't a sepsis, a bacterial infection that's really starting to take seed, because at that point we may need to intervene and do something.
Another topic that I wanted to touch on that I think you're seeing a lot in your practice and that you had mentioned to me you wanted to share, and I love it, is sleep.
Sleep. It's my favorite thing to talk about, just because it does impact so many parts of a child's life. For me, so many of the things that I see in my outpatient practice are concerning behaviors, outbursts, learning challenges, hyperactivity, anxiety, and so many of these are impacted by sleep. So I think it's the one thing as parents we obviously work on every day, because as parents we're always trying to get our kids to sleep and get them to bed, and everyone's doing the best they can, but just really focusing on that effort that you're making as a parent and how beneficial it is, and how any of those bedtime issues, battles are so worth it, because having your child get a good sleep really does impact so much of their day. We've got lots of kids here in our community who are great little athletes. And even them, I would say, those kids that are busy athletes need even more sleep. And that's hard when we're battling the rink times, the early wake ups, the tournaments that are going late. But just to really view that as one of the most important pieces of their development. One of the most important things you can do is learn a little bit about what sleep requirements look like in an infant. There are lots of resources out there, and you certainly don't have to follow any single one of them. There's lots of different theories and opinions about sleep training and how and why and when and where you should do it all. And I would say none of that really matters. What matters is that you're consistent as a family. You choose a sleep schedule that works for you. You choose a sleep routine that works for you. And you really try to teach your child from an early age the importance of sleep. If I have one recommendation that I make to new parents, it's that most babies are kept up a little longer than they should. So I have a 90-minute rule that babies should never be awake for longer than 90 minutes. That is very easy to do when you've got a tiny little newborn who's sleeping all the time. But by 8 weeks, 10 weeks, 12 weeks, as babies start to interact more and they start to like you a little more, it is important to keep their awake time to no more than 90 minutes, as that really then promotes them going back into a crib or a bassinet when they are still awake, but they're drowsy and they're ready to think about sleep. And then as kids get a little bit older, then we move into just a bedtime routine being really important. And again, that can look like anything you want. Doesn't have to be specific bath or a specific book or anything. Just pick what works for your family and stick with a routine that teaches a child, a short, sweet routine that teaches them that it's bedtime and that it's time for them to learn how to fall asleep. Learning to fall asleep is a really important job for kids. It's one of the most important developmental skills that they need to learn. So people worry about, did my child crawl? Are they sitting? Are they speaking? I'm more interested in, are they sleeping? Are they learning how to sleep on their own? So when kids are entering grade 1, grade 2, they still need about 12 hours of sleep a night. And if families are having to get up at 7 to get to school, well, that means that your child has to be asleep by 7. So just remembering that those early bedtimes in those early school years are really important. And the sleep hours doesn't change much as you get older. So even the rule is kind of at 10 years old, you still need about 10 hours of sleep a night. And then most teenagers still need around 9 hours a night. So the teenage sleep issue is a whole other ball of wax. So anyone with a teenager knows how difficult it is to match their circadian rhythm with what school is requiring them to do. And so again, at teenage years, I would say the most important thing is trying to get screens out of the bedroom. And that includes TVs, phones, video games. They shouldn't be in the room with the children. If they are complaining about needing an alarm clock, you can get them an alarm clock at the dollar store. But really, screens should be off at least an hour before they're falling asleep. And so if for a teenager, if you're thinking that they need to be asleep by 9:30, well, then screens are off by 8:30 and screens out of the bedroom, which I know is a battle that every family is having. And please keep that battle up because it is really important for both their mental health and for their sleep habits to get them off of those screens in the late evening. My other favorite tip for babies, kids, adults is just a basic white noise machine. So having that white noise that's just playing consistently in the background, just a nice sound in any bedroom will help all children. It'll help their sleep-wake cycles. It'll be a consistent way for them to help get to sleep and to stay asleep. And so I love a little white noise machine is the best $20 you'll ever spend. I personally think that melatonin is a great tool for those kids that are struggling, but not without also putting those environmental things in place. So if you aren't turning those screens off, you're not having a routine where your kids are reading for a few minutes before bed, the room isn't, cool and dark and maybe a white noise machine on in the background, then the melatonin is sort of a band-aid, but you're not actually dealing with the true environmental issues.
Well, thank you very much for being here. And if there was anything else you wanted to share, I will give it away to you. If not, we'll end it here.
Hey, thanks, Danica.
Thank you. Thanks so much.
Let me know if you need me back.
Of course.